That's right. Joe Ibrahim was at the press conference. He's a Western Sydney intensive care paramedic, and we've heard the stories over the past couple of weeks of just how long those shifts are for them, particularly dropping off patients where they have to wait for hours and hours at hospitals like Westmead to unload patients. He talked about some of the things they have to deal with going through a shift, including wearing that full PPE and having to do very exhaustive things like performing CPR in that full PPE. Here's a bit more of what he had to say today.
When I joined this profession years ago now, I knew that it came with a level of risk to serve our community. For the very first time, though, I'm now bringing this risk due to this contagious virus home to my wife and my beautiful boys. I know and take comfort in the fact that vaccinations break the chain of transmission, and I'm grateful to be vaccinated. This truly does give me comfort.
Kenny, the Premier was forced to defend Sydney's hospital system under significant stress with those rising hospitalisation numbers.
Yes, you mentioned those numbers before, 840 now hospitalised due to COVID-19, and the Premier says the worst is still to come with the hospitalisations. The Premier says she thinks that it's going to be peaking in October, which means it's progressively going to get worse and worse. And we know those Western Sydney hospitals like Westmead and Blacktown are stretched to the limit at the moment. But here's what she had to say, saying that the network as a whole can cope. She is confident even as it starts to peak in October.
What we do know is that at this stage, we're hopeful that once we get those vaccination rates up, the rate of hospitalisation declines. But we also know from the information we have, the accumulation of cases and also the number that are still unvaccinated, that October is likely to be our worst month in terms of pressure on the system. And that's why we're gearing up for that. We have been for nearly 2 years. Can I state again, our hospital system is under pressure. Will we need to do things differently? Of course we will. Will we need to manage things differently? We're in the middle of a pandemic, of course. But will we cope? Of course we will.
And then there's the vaccine. It was another record day of vaccinations in New South Wales. 6.8 million jabs. 66% of the population has had one dose. 36% has had 2 doses. The Premier says that those freedoms are still coming when we hit that 70% mark double dose. But she also wouldn't say whether people in local government areas of concern will be getting the same freedoms once we hit those targets. Here's a bit more of what she had to say.
When we get to 70% double dose, the freedoms that we'll be experiencing will be those who are fully vaccinated. But also at 70% double dose, there'll still be restrictions in place. You'll have to check in, you'll have to demonstrate you've been vaccinated, you'll have to demonstrate social distancing, you'll have to make sure that in certain settings you're wearing a mask. As our vaccination rates go up, the hospitalisation rate of cases is likely to come down.
Now, Tom, the Premier also said that a few LGAs of concern, which have the harsher lockdown restrictions like a curfew, the ones that are doing quite well could actually be soon lifted out of that concern status. She wouldn't say what it would be. Some reporters suggested Burwood, considering that they had no cases there on Friday and the vaccination rates are quite high. So that's something we could see in the near future, is that some local government areas of concern could actually see restrictions lifted in some spots.